As men age, levels of testosterone naturally decrease in some. To avoid adverse effects, some men choose to have it replaced artificially. Several new studies indicate that testosterone replacement therapy is not without its side effects. Studies show treatment may improve bone density and anemia. On the downside, it may increase the amount of plaque buildup in coronary arteries. So let's sort it all out. Dr. Ali Khosrayan with Khosrayan Urology here on The Morning Show. Let's weigh the benefits against the risks.
When you look at testosterone supplementation, one of the key things to keep in mind is whether or not you really need it. You know, testosterone can be euphoric. There are a lot of clinics that are age wellness-based clinics that talk about the benefits of being on testosterone, but it really depends on what your testosterone at the start is, married with symptoms associated with having a low testosterone level, energy depletion. Some people can have a decrease in sex drive or libido, translates into erectile function issues, and a number of other side effects. So the key is why you're going on testosterone supplementation. Many studies have shown actually if you have a low testosterone level and you're supplemented appropriately to levels that are appropriate, it's actually safe. And actually, studies have actually shown the controversial increase in cardiovascular effects, which comes up in a number of studies. There are many studies show that actually it's safe. One was actually just published in the Journal of American Medical Association that talked about a significant decrease in cardiovascular events when you're appropriately supplemented with testosterone. So the key is, why are you supplementing? And if it's done under the guidance of a physician, if your baseline levels are monitored, you find out actually why your testosterone level is low to some degree, and then you supplement it under close follow-up of a physician to appropriate levels. Then it can be safe and actually beneficial, because low testosterone levels can actually carry with them same cardiovascular risks and other side effects.
Okay, let's say that I visit the doctor, my blood work comes back, and it says my T level is well below where it should be. What questions should I be asking?
First, you should talk to your doctor about why is it low. You can check some of the precursor hormones that influence testosterone, and sometimes they can have an influence. So that's one. The other thing is talk to them about the risk benefits of testosterone supplementation for you personally in light of your whole medical history and your goals for therapy. You know, the American associations that look at this, the endocrinological societies, have recently come out to say that a low testosterone level has to be one. You have multiple levels that show a consistent low testosterone level, and less than 300 is one thing they look at, married with one or two symptoms associated with low testosterone levels. So it's key to be mindful of why you're starting, having a detailed conversation about the risk benefits of starting for you personally, and then when you start, you have to follow it closely.
Have you found in your patients that have this T therapy that it improves their sexual function and even mood in men?
It can. So irritability, whether you're depressed or more irritable actually, so some mood disturbances can be associated with a low testosterone level. You can get an increase in abdominal girth. Some people get breast tenderness. And so when you look at those symptoms, it's important to discuss that with your physician, because if you supplement with testosterone appropriately, those symptoms can be improved. And there are multiple different ways to supplement with testosterone, and those are important things to talk with your physician.
There are prescriptions that are available, but you can also, frankly, walk into, you know, any of the big market stores, drugstores, or what have you, and they're over-the-counter supplements. Often those aren't vetted by the FDA.
They aren't. So supplementation, even though this idea is that if it's holistic, if it's not a pharmaceutical medication, it's safer. However, pharmaceutical medications, for whatever your thoughts are in the pharmaceutical industry, the FDA does a great job of making sure that safety is the predominant factor of looking at medications that become FDA approved. So medications that you have to get a pharmacy prescription to obtain are generally studied with a lot more impunity and a lot more skepticism until they're allowed to be on the market than medications that are supplements, because it's not only the active ingredient in the supplement, what it's mixed with. And a lot of times those are not consistent, and they may have negative impacts on you, and in light of the other medications you're on, they could have contraindicated associations that we may not know the details of.
So the biggest takeaway from this discussion is, number one, get to the root of the problem. Number two, find out if this testosterone therapy is good for you. If you want to revisit this discussion and for the latest health headlines, go to newsforjax.com. We'll post this interview online under the video section on the Morning Show page at about 10:30 this morning. Doc, always a pleasure.
Thank you very much.
Appreciate having you here.